Is India on the brink of another COVID-19 wave? With new cases spiking across major cities, two mysterious new variants spreading, and the first fatality of this outbreak already reported, here's what you need to know right now to keep yourself safe. As COVID-19 cases surge across India, hear what's happening. India has just logged over 750 new COVID-19 cases in the past week, pushing the nation's active caseload above 1,000 for the first time in months. This sudden jump comes as health officials confirm the presence of two new sub-variants, NB.1.8.1 and LF7, now under global watch by the World Health Organization. Let's break down the numbers. Kerala is once again the epicenter, reporting 335 new cases and an active caseload of 430. In Maharashtra follows with 153 fresh infections and the first COVID-19 fatality of this outbreak, a woman in Mumbai. Meanwhile, India national capital, Delhi recorded 99 new cases, with 104 active patients, and health officials say most cases are mild, but hospitals are on alert. Other states like Gujarat, 83 cases, Karnataka, 47, Uttar Pradesh, 15, and West Bengal, 12, are also seeing an upward trend. Let's take a look. What's driving the surge? The Indian SARS-CoV-2 Genomics Consortium, INSACOG, has confirmed that the new variants NB.1.8.1 and LF7 are circulating. And while the WHO has not classified them as variants of concern yet, they are being closely monitored due to their rapid spread. Experts believe this uptick could be due to waning immunity in the population as time passes since previous vaccinations or infections, increased travel and social gatherings, the emergence of these new sub-variants, whose impact is still being studied. So, how serious is the current situation? While most cases are currently mild, the first fatality in Maharashtra is a sobering reminder that COVID-19 is still dangerous, especially for high-risk individuals. In Maharashtra's 4 new COVID-positive patients were detected, with 1 fatality, and other is still in treatment, and the last has been shifted to a larger hospital for care. Meanwhile, Delhi's Chief Minister and Health Minister have both reassured the public that hospitals are well prepared, with adequate beds, oxygen supplies, and medicines. However, the advisory issued urges caution, not complacency. Karnataka's numbers are also worth watching. With a 24-hour positivity rate of 19.37%, Bengaluru alone saw 35 out of 37 new cases in the state. And now let's take a look. What are the symptoms? And who's at risk? Most recent cases resemble seasonal viral infections, with symptoms like fever, cough, and cold. However, the risk remains for the elderly, immunocompromised, and those with chronic illnesses. So here, what should you do right now? Don't panic, but don't ignore the risk. Most cases are mild, but the virus is still circulating and can be deadly for some. Follow state advisories, maintain good hygiene, mask up in crowded places, and avoid unnecessary travel if you feel unwell. Monitor for symptoms. If you develop fever, cough, sore throat, or cold, then get tested and isolate if needed. Stay updated on vaccinations. If you're eligible for a booster, get it, especially if you're in a high-risk group. Watch for updates on new variants. The situation with NB.1.8.1 and LF17 is evolving. Stay tuned for guidance from health authorities. But why this matters? The COVID-19 pandemic taught us how quickly things can change. New variants can spread fast, and even a mild rise in cases can put pressure on hospitals and vulnerable communities. With India's numbers rising and the world watching these new variants, now is not the time to let your guard down. Stay alert, stay informed, and don't wait for the next wave to catch you by surprise. For the latest COVID-19 news, variant updates, subscribe to Health Bulletin now.